The spread of the super contagious Delta variant is prompting new lockdowns around the world and new health warnings. So does the call for masking mean that vaccines don't offer enough protection? And should vaccinated people be worried? I asked Allina Health infectious disease specialist Dr. Frank Rhame those questions tonight. So tell me a bit more about the Delta variant. We've heard a lot of headlines. A lot of people are talking about it, but what do we know about it?
So I think it's important to recognize variants can do a bunch of things, like evading vaccine and evading monoclonal antibodies and being more severe illness. But the one thing that's easiest to determine is their transmissibility. And it looks like this variant, the Delta variant, is way more transmissible than any disease we've had before. It took over the UK in 2 months. It's behind the surge in Indonesia. It's behind the surge in a bunch of countries. It's behind the surge in Sydney. Mind you, in Sydney, 300 cases is a surge, but that's have a very different attitude than we do. And it's taking over the United States. There are places in the United States that are already more Delta than any other virus. Now, that's important for a couple reasons. One, increased transmissibility raises the threshold for herd immunity. So the herd immunity threshold, what fraction of people you've got to get vaccinated or immune to stop transmission, is intensely related to the transmissibility. And that's going to make the target higher to get this virus stopped in our country.
So we know it's more transmissible. Are we going to get more sick if we contract this Delta variant?
It does look like this causes increased severity of disease. That's harder to know for sure, but it does look like that's the case.
If you are vaccinated, do you have to worry about the variant?
Yeah, so that's the first lesson. If you're vaccinated, this is a minor problem for you.
Do the vaccines that are out there have protection then against the variant, or do some work better than others? Have we gotten that data?
If you get that second dose in the Pfizer vaccine, protected you against the old viruses to about 95%. To the new virus, the Delta virus, it's about 90% infection. So it does drop the protection a little bit, but it does not cause the severe illness. That's the key thing. And that's what we really care about the most. I never worried about getting COVID. I didn't want to get hospitalized or be on a ventilator or die. COVID I was okay with. And I'm not going to die because I've had my 2 doses of vaccine. And why it is that when people hear a statistic like I just said, if they ever listen to it, they don't want to get vaccinated is completely inexplicable. It's true that almost everybody dying of COVID is unvaccinated. If you believe that, and how could you not, why wouldn't you get vaccinated?
My question is about the community around you as well. You have better protection, right, if more of your community is vaccinated. And so when you're traveling, do you have to keep in mind vaccination rates there or positivity rates?
The point being, if you're in a place in the country where there's very little community spread of COVID, you do not have a 10% chance of getting COVID. So it's very much dependent on the community spread in your area, how you should react. If you're in a place like, so there's some 3,000 counties in the southern part of the United States that have vaccination rates under 30%. And those places are very vulnerable to having surges, local surges, not national surges. We're not going to go back to what we had in November, but we had like 7 deaths in Minnesota yesterday. So is that okay? No, that's not okay. We can stop those deaths altogether if we can get the herd immunity. It's way better, and we're not going to go hugely over that like we were in the bad days. But any death, our standard should be stop this virus altogether.
Last question, what is our risk of getting COVID-19 if we're fully vaccinated?
So your risk is, if it's Pfizer, and I think you can extrapolate to Moderna, is 10% what it would have been if you had not gotten vaccinated. So it will reduce your risk in a given setting by 90%. But that depends on what your exposures are. And if you do get it, it's not going to be severe. It's not going to kill you.
You'll find the latest on the pandemic at WCCO.com. We'll be right back.